Kema from Kenyatta National Hospital. Oh, my name is John Kagema, Kenyatta National Hospital. I'm a respiratory nurse. So I'm the support system and the spearheading for the workshop. And also we are the people that train the nurses from this country on the procedures that we are doing and what we are, and the preparation of patients, because you cannot do a procedure without preparing the patients and only going through all the processes so that we can be able to be where we are, and also to make sure that the whole system is able to accommodate the work that we are doing. With the support of the nurses in this hospital, the ones that we train together with the whole system, and the doctors in this place, and our doctors, they have been able to be where we are today, that we have been able even to do just cases as per today. Yes.
So how many nurses have you trained?
I've trained 3 nurses in this institution. Yeah.
Okay, maybe where have you been, and the reason as to why you decided to do what you're doing?
We are building a capacity, and we are hoping to build more capacity for other counties and other institutions where there are equipment, so that we can be able to handle them and to do the procedures and to take care of the patients, because the issue here is about patient safety. So if we have to train people on how to do the procedures, how to clean up the equipment, the safety of the patients, and how we can be able to take care in the right way and professionally. Yeah.
Good afternoon. My name is Dr. Andrew Uhuru, a pulmonologist in the Kenyatta National Hospital and a board member of the Respiratory Society of Kenya.
Tell us basically about the activity today and so far where you have been, where you started, and so far maybe some of the procedures you've already done.
So we are here in Kakamega County to try undertaking a workshop on bronchoscopic services, which have not been happening in this county. And this is a process that started in earnest early last year, where we actually had specialists from different counties coming to the Kenyatta National Hospital for a workshop for actually being able to start bronchoscopic and thoracic surgery services in the counties. Basically, what we are looking at is devolving highly skilled services down to the counties. One, to try and get Kenyans to get services nearer to where they are. And then secondly, to also help us in the national hospital in terms of decongestion, so that we're not overwhelmed by cases, that we're only doing the complex cases and the simpler ones are being carried out in the counties. The government had supplied some counties with equipment for doing bronchoscopic services. We actually have 6 counties. We already had a workshop in Mombasa County in November last year. Kakamega County is the second county where we actually are doing a follow-up workshop to actually try and get bronchoscopic services up and running. Dr. Biko here was with us. He's been with us in the last 2 years. We've had a workshop in Kenyatta to try and build his skill and capacity. And today we are here for him to be able to fulfill what he started a few years ago of being able to actually do these procedures. We are grateful for the Kenyatta National Hospital and the Respiratory Society of Kenya. The Respiratory Society of Kenya is actually our lead sponsor in trying to make sure that respiratory services are available to Kenyans countrywide. We also want to thank the government because the social health insurance is actually covers for these procedures. So we are encouraging Kenyans to continue to register for this endeavor so that they can continue to benefit from these services that are in much demand, especially here in the counties.
So other than Kakamega and Mombasa, which other counties were given the equipment? But also here in Kakamega, how many procedures have you done so far?
So far we have already, yesterday we did 6. Today we intend to do another 6. We had 5 bronchoscopic procedures. We had a vascular surgery done. Today there are going to be 4 thoracic surgery procedures. And we're going to have 3 bronchoscopy procedures. We've already done what we call a transthoracic biopsy for a patient who has a tumor in the chest. We are aware that there are about 6 counties which have the equipment that are yet to start. So Meru, Machakos, Bomet, Eldoret are yet to start. Now Kakamega and Mombasa are already ongoing. So we intend to be able to next probably go to Eldoret. I think they are ready. Then perhaps move to Meru, Bomet, and Machakos. Yeah, to actually get the bronchoscopy services and thoracic surgery also, because they work together so that patients are actually able to benefit from these services near home.
You talked of the capacity building. How many doctors took part across the country?
Have we?
How many took part in the capacity building?
So we've had bronchoscopy workshops running from 2023. We've had about 20 doctors from across the country. Dr. Biko here, I think, has come for both our courses. We have, I think, the doctors in Mombasa have also participated, and they've been a doctor also from Eldoret, and that's why probably Eldoret will be our next center, where we actually, the Moyen Teaching and Referral Hospital, to actually be able to get them up and running. They've already received also equipment to actually be able to do advanced diagnostic tests for patients who actually have lung cancer, which will make these patients be able to access treatment that will be able to prolong their survival, even for patients who have advanced lung cancer. We already have patients already doing 1-2 years with lung cancer, and this is a disease that previously life expectancy at diagnosis, especially with advanced, was just about 4 to 6 months.
I believe early diagnosis is very important.
Yes.
Probably if you talk to Kenyans about it, the signs and symptoms and what needs to be done, before it advances to other stages.
So one would start with patients who are known to be cigarette smokers. They are at highest risk. So we want to request any patient who's a cigarette smoker, especially if you've been smoking cigarettes for more than 10 years, then the risk is higher. You need to go and get evaluated. Unfortunately, for lung cancer, by the time you have symptoms, usually it's late. So the lowest hanging fruit is usually any person who used to smoke or currently smokes and has been doing it for a minimum of about 10 years, needs to actually go to a health facility, get imaging tests done to actually see if they already have lung cancer already developing in their lungs. For patients who also have, now that we are here in Kakamega, the healthcare teams have actually been screening patients who were potential benefits for this workshop. Yesterday we had a lady who presented, she's been coughing blood. So one of the symptoms is patients who've been coughing blood. They'd already done TB tests and they were negative. Unfortunately, for some of these respiratory conditions, it's a bit difficult to distinguish them just from symptoms alone. So a patient with lung cancer can have cough blood, patients with TB can cough blood, but if there's a patient who's had investigations and TB is not there, then you want to go ahead, image the chest, and if the patient has something that is suspicious, then they'll need more workup done in terms of diagnostics.
Without insurance, what is the cost?
Basically, this is an expensive procedure to do, so we are actually having bronchoscopy being done and thoracic surgery. These procedures would range from about, if I'm not wrong, Joanne, from about 78,000 all the way to about 400,000. And SHA actually reimburses for these procedures. So even for the other counties, we would highly encourage them to actually be able to see if they can be able to acquire the equipment, train their healthcare staff, healthcare teams to be able to deliver these procedures, because there will be reimbursement from the Social Health Authority for these procedures if they're doing for patients. So it's a form of revenue generation even for Kakamega County. They now have a new stream. Yes. So the question is about risk factors for respiratory diseases. So as I'd mentioned before, persons who smoke tobacco, whichever form, are at risk for respiratory illnesses, including our young adults, the youth who are vaping. It's a very high risk factor for respiratory diseases. We already have a few young people who've had almost total destruction of their lungs secondary to vaping. We also are a country where majority of the population still use what we call biomass fuel. So basically the use of charcoal, the use of firewood, and the use of kerosene as a source of energy puts you at risk. The smoke from this biomass is actually a risk factor for actually developing respiratory illnesses, not only chronic obstructive pulmonary disease, asthma, but also we are seeing increasingly lung cancer because of exposure to biomass. The other thing that is of great concern is, of course, the socioeconomic status. Respiratory illness tends to discriminate. So TB discriminates quite a lot, especially with socioeconomic status. People of lower socioeconomic status are disproportionately affected because of malnutrition. And then there is the issue about social cultural behaviors. So people also who tend to overindulge in alcohol would also be at risk just because of the socioeconomic, sociocultural practice or behaviors that also put them at risk for this illness. Lastly, it's your family genetics. So in your family, if there is history of respiratory illnesses, then that naturally puts you at risk. For example, people who have asthma, it tends to run in families.
You talked of decongesting Kenyatta Hospital. Like, what are the numbers you're talking about?
So when we talk about decongesting, it's not, we are talking about services. So if we have to reduce the backlog, the waiting time, because you've had many times patients have gone to Kenyatta and they had to wait for a long time either before their procedure was done or their surgery was done. These are the things. If bronchoscopy is available in Kakamega and it can be done, then it would mean that the waiting times for some of these patients will actually reduce. Yeah.
Been receiving these numbers here and having these services here for the very, very first time. If you can tell us about that.
Yeah, well, first of all,
Start with the name.
yeah, Dr. Steve Biko from Kakamega County. So, one, we are, very grateful to RESOC, the Respiratory Society of Kenya, for, working with us from the formative stages up to where we are right now. Just to highlight what RESOC actually has done, one, our engagements began around the time of COVID, so they started to highlight what respiratory medicine is, and in collaboration with partners, at that time the Mark Foundation, they actually facilitated for a number of Kenyan doctors to be trained on respiratory medicine in collaboration with the universities out of the country. Thereafter, they followed up with the now skills training, which they have been doing from basics to intermediate level training to advanced level training. All of these things at the expense of the association. So I'm actually one of the beneficiaries of these initiatives, and the aim, of going through all this was to try and roll down these services down to our population. And the reason why we needed to do that is because there are many patients, and you see lung illnesses are an enigma to many people. Many people think that most of the lung issues, we even have the younger population with their unique mix of lung diseases. So now in Kakamega, one thing is that we are now able to at least do something that was not being done. We have the capacity to image externally, that is with the cities. We have the capacity to do bronchoscopies, whereby you do internal assessments. We have a cardiothoracic surgeon who can now move beyond that level, and we even have an ENT surgeon with us, he's here, Dr. Malenje, who also can handle the airway from his perspective. Yeah. So the patients are there, for sure they are there, and there are many. Yes. And maybe just to add, we also have an ICU that also borders on lung health issues. Yes.
Okay.
Maybe do you think we need to really give a special attention to the vulnerable? Maybe talk about children, pregnant, maybe elderly.
Yes.
How are they so prone to this illness?
Yeah, when the population that is labeled as vulnerable come to us, we, of course, you know, vulnerability is several things. It's not only age, even the socioeconomic status is a vulnerability by itself. So there are mechanisms of assisting. Now, we have pediatricians in the hospital to look after the younger population, gynecologists to look after the same, and they can access all these services, you know, as we have said. They are not restricted to, you know, a particular age group or a particular substrata of the population. There have been initiatives by our hospital through the social work department to try and make even healthcare accessible to people who can't pay. And there have been initiatives sometimes where the county, upon identifying a vulnerable individual, actually pays SHA for them. So that way their cost of treatment can be covered by someone. And the county also does not, you know, just incur what would call like a total loss of revenue. Yeah.
You talked of gold mine. Is it one of the reasons as to why maybe you have such cases, a lot of them here in Kakamega?
No. The gold miners are not very many, the ones who present with lung diseases, but they occasionally do come.
It's a risk factor.
Yeah, it's a risk factor for lung disease. Yes. The gold mines, because there have been a big issue in Kakamega. I've been here for some years, and the way most of the people from the mines present, these are people who process the gold, not the ones who go in. The way it's processed, once they get the material suspected to have gold, is that they boil it with mercury. So that mercury vaporizes, and they breathe it in. So when you find them, most of the time their lungs are actually they are scarred. And if you do an X-ray, it's you know, from a lay point, how would I describe it? It's like they are shining. You know, they are emphasis. It's some kind of emphasis because of gold deposition in the same. Yeah, so that is actually what happens. So we have actually been discussing even with our ministry about safety in the mines, because they are informal. It's an informal sector, so sometimes trying to introduce safety in those mines is not very easy, but it's something that has been captured. And I think, okay, the numbers are not many, the people who come in, but it's something that we really need to think about. Yes.
So as medics, are you like recommending they should have special masks?
Yeah, those are some of the things that the occupational health department is trying to enforce, especially on those people who process, because they boil it and the mercury has to evaporate. Yeah. Yeah.
Very much. I'm Dr. David Alila, Chief of Some Medical Services. First of all, I'd like to thank Dr. Biko with his team who have come to, they're dealing especially with the lungs infection, isn't it, within our patients. I'm aware that SHA is assisting in most cases for the lung. You said it is 78?
Yeah, for bronchoscopy 78.
Bronchoscopy 78, and
for the other procedures it's
200.
Up to 400.
And they are able to pay, isn't it? And therefore, you see, SHA is able now to assist the vulnerable. And that's why we've been going around telling our citizens, Kakamega citizens, that they register for SHA so that they can be able to get medication. As a county, we've been able to train doctors. We have a thoracic surgeon, Dr. Jedida, We train nurses also, and we are continuing to train. We have equipment, we service the equipment, we are buying medication, so that this kind of medication can take place within. And I'm so happy with those who've come from outside. Now they've ignited the whole process. We might think that this kind of treatment is not taking place, but with them now, the public is able to know that this type of treatment can take place in Kakamega, not necessarily referring our patients to Nairobi, especially KU.
Kakamega County will be offering these services in the region. Are you will you be able to deal with the cases that will be coming from the region, not necessarily from Kakamega County?
Yes, we are able. Because we have the equipment, we have the doctors, we have the nurses, we have the COs who are able to handle that. Yes.
Exact number of doctors.
Those who are concerned with this kind of, we have one, Dr. Jedida, and this kind of treatment, they can't do it in isolation. Okay, it involves so many. Dr. Biko, physician, is able to detect, isn't it? Then recommends. ENT is here. Dr. J is now. Okay. They are able also to examine and then recommend, so that the surgeons can be able to carry out the process. It's not done in isolation. So you can't specifically say that we have doctors for this. We have them, but it's a team. Okay.
Thank you so much.
Majina yangu najulikana kama ni Frida Nahumicha Muyumba, na nimekuja hapa kwa matibabu ya kifua. Nilikuwa na hiyo shida, nimekuwa nayo na miaka 2 sasa. Lakini nimetembea kwa matibabu, lakini vile hii kambu ilikuja, daktari wangu alikaniambia nikuje waniangalie. Sasa nilionekana na ninajisikia vizuri.
Hapo nyuma kufanya kazi, ulikuwa unajisikia kilinganishwa na sasa? Ulikuwa rahisi kufanya kazi za kawaida, kupika nini, moshi ilikuwa inaathiri?
In fact, nilikuwa nimekatazwa kuingia jikoni mahali pako na moshi. Sasa nilikuwa tu nakaa, siwezi fanya kazi yoyote. Yaani hii moyo wangu haitakana isunguke. Na nikae tu mahali nimekaa nitulie. Ndio hiyo pumzi sasa inipe nafasi nikipumua. Lakini sasa saa hii naweza sasa ongea na naweza tembea kidogo. Sasa sijui kama nimepona sana. Saa ingine nirudi nyumbani ni hiyo matatizo iendelee.
Kwa miaka hii mtu ilianza nini?
Ilianza wakati nilipata accident ya pikipiki. Na nikawa na fracture ya mgongo. Sasa nikaenda Kakani, wakanifanyia surgery. Sasa immediately kutoka tu kwa theater, ndio daktari aligundua hiyo oxygen yangu iko chini. Wakanipeleka kwa ICU hapo for 12 hours, nikatoka. The following day nilikuwa nimepick up. Ilikuanga 87. Sasa wakati nilitoka nilikuwa imeingia 90. Na wakanirelease nikaenda nyumbani. Vile nilienda nyumbani nilikaa tena ikanirudia. Sasa nilikuwa naendanga kwa daktari hapa Kakamega anajulikana Dr. Steve Biko. Alikuwa ananipea madawa nikitumia at long last akaniambia kuna kampu inakuja kutoka Nairobi ukuje wakuangalie. Sasa nilikuwa hapa tangu Jumatatu.
Ukiwa kule nyumbani kuna baadhi ya kina mama ama mtu yote ambao pia unasikia wanalia mambo ya kifua inawauma, ukienda kidogo mama anatembea kidogo na kifua. Pengine unaweza ambia kuna vitu ama kuna watu kama unaona kule nyumbani kwa vijiji?
Sasa unajua kama ukikosa pumzi, wamama wako wengi na shida yao wanalia miguu. Na unajua ukishindwa kutembea basi hiyo pumzi ndio iko chini. Sasa hatujajua chanzo kabisa. Labda mimi nikipona kabisa nitawaeleza. Kama hiyo pumzi ni kidogo ndio inasababisha hiyo kutembea inakuwa shida. Sababu mtu anasikia mlegevu sana, mchovu, hawezi, hata kazi hawezi, hata kupepa kitu huwezi. Kazi yako ni kukaa tu.
I'm Joshua Odhiambo from Homa Bay. I came here to seek medical assistance. I've had chest problems since last year, July, when I started coughing and coughing blood. I've been to several hospitals in Homa Bay, and the first one, I had a chest x-ray done, and it was very suggestive that I had pulmonary TB. I was placed under medication for 6 months. Then upon completion, it again reoccurred. It forced me now to seek proper medical attention so that we could know the source of that blood. So when I went to Kisumu to meet a pulmonologist, she referred me here to come and seek more clarification on the cause of that blood. So when I came here, I found that things were very okay. I met several doctors which recommended that I have bronchoscopy test done. It was done yesterday. The process was very comfortable. I'm very optimistic that I'm going to get the best result and know the cause why I was vomiting or coughing blood. Doctors had a sample taken from my lungs, which will be taken to Aga Khan, Nairobi, for further analysis by pathologist. So far, everything is well. I'm very okay right now, as you can see. I hope everything went as planned by the doctors. I want to say that initially it was very complex to me to get to know what was the problem, because most of the doctors whom I was meeting were just clinicians, and maybe they didn't know the cause. Majorly they were just trying to stop the blood, but they didn't know the main cause, why the blood was coming. So to date, I'm very optimistic that at long last I'm going to find better medication from these hospitals, because the doctors whom I met yesterday were very optimistic. So far, according to reports, there is no much damage in the lungs. Yeah, so I'm very optimistic that all will be all well.
Maybe shortly, how long have you been in this problem? And maybe there are some of the few things in the, when maybe you are working, have you been able to work on or to do, any task, or how do you feel maybe through the chest?
So I started being unwell from last year, July. And since then, I have had difficulties in doing work because I do feel chest pains. So it has been severe chest pains, though after being placed under antibiotics, it do go down. So I've had difficulties in doing my daily chores up to now. That is.
If you check from where you come from, is it the only that you are the only person who maybe underwent it, or you have maybe met different people who always care about their chest, and they look for medication?
Back home, I've visited several hospitals, and I've seen people suffering from similar conditions. But the hospitals where they go, we do find that there are no proper medications or proper consultants, proper doctors to deal with the conditions. So some of the tests which they are done is just the X-ray test, which is not conducive enough to diagnose severe illness dealing with lungs.
We know Kenyans are going in difficulties in terms of share. We had the NHIF, which has also been helping them to go through medication, different hospitals. Do you think there's not enough resource or money to treat these people, and how expensive, or in terms of expensive, is it maybe to get that treatment? Do you think maybe a normal Kenya can afford that?
This treatment is very expensive. For a normal Kenyan, given the current situations, the economic times, sad economic times, it is very expensive for the normal Kenyans, because you do find that in most of the hospitals which offer this comprehensive test, they require cash. So it is becoming very expensive for them. But when it comes to SHA, I want to say that as we are today, it has peaked and it is working, because mostly the treatment which I've done have been using that SHA. And even here I'm optimistic that SHA is going to cover the cost of that test. So as to now, SHA is very effective and it is working. The reason why most people are not going to hospital is because they fear that maybe the program is not working out. But according to me, SHA is working. But the only problem is cost of diagnosis of this problem. Most of the x-rays are very expensive, because even if you look at the cost of bronchoscopy, it is on the higher limit. Even chest x-ray is on the higher limit. So I think what is discouraging people from going to hospital is just the cost of the medication of these lungs problems.